A 48-year-old female patient came to the Department of Periodontology, with a history of crown fracture at the cervical region in relation to 21 and also pain in 11, which was previously root canal treated. The patient was not willing for retreatment and requested for an immediate solution. Hence, immediate implant option was planned. On clinical examination, Ellis Class III fracture was observed in relation to 21. Preoperative radiographic examination was done using intraoral periapical radiograph (IOPA) and orthopantomogram for appropriate treatment planning. Clinical and radiological examinations revealed adequate bone support with no periapical and periodontal pathology. So, it was decided to place the implants immediately after the extraction to provide benefits such as preservation of bone and soft tissue aesthetics. The procedure was carried out under local anesthesia using 2% lignocaine with 1/200,000 adrenaline. Teeth were extracted atraumatically using root forceps. The extracted sockets were examined for any osseous defects and periapical infection. The sockets were completely debrided using curettes, irrigated using povidone iodine solution. Sequential drills starting from 2 mm to 3.2 mm were used and osteotomy sites were prepared. Guide pin was placed into the extracted socket to check for parallelism with adjacent and opposing tooth. 2 implants of size 3.75 x 11.5 were placed into the socket. Initial primary stability was obtained. Bone graft, osseograft, and platelet-rich fibrin were used to fill the jumping distance between the implant and the surrounding bone. 15 degrees angled abutments were placed, and flaps were approximated using 4-0 vicryl sutures. Postoperative IOPA was taken to check for angulation and placement of implants. The patient was provided with temporary acrylic crown postoperatively around the same day. Postoperative instructions were provided, and the patient was recalled after 1 week for suture removal. The patient was asked to report after 4 months for the prosthetic rehabilitation. Open tray impression was made, using open tray coping and addition silicone impression material. Jig trial was done to verify the alignment of abutment with adjacent teeth. Vita Classic shade guide was used to decide the shape of the prosthesis. All ceramic prosthesis was fabricated. The crowns were luted with glass ionomer cements. The patient was reviewed after 9 months, and IOPA was taken. Radiograph reveals no evidence of bone loss and periodontal pathology.